country is only stronger if the citizens or the subject of the country are healthy. So it is a right of a citizen because public health is so far widespread. It brings out information from each and every field which a citizen or an individual encounters or uses in their day-to-day life. Okay, so being from mental health, uh, occupational health, environmental health, infectious diseases, epidemiology, etc. Everything. I mean, so public health blows my mind how intense and altruistic it is by nature.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Tarjani Vaidya. Tarjani is a self-employed public health consultant and public health data scientist. She's also a senior public health consultant with Amaka Consulting and Evaluation Services. She's an experienced public health researcher and consultant with a track record of contributing to impactful projects in quantitative research, data management, and epidemiological public health initiatives. Skilled in coordinating with stakeholders, conducting independent research, and optimizing research outcomes. She conferred a Bachelor of Science in Microbiology and a Master of Science in Biotechnology at Gujarat University. She then conferred a Master's of Science in Molecular Medicine at the University of South Florida, followed by a Master of Public Health at the University of Texas Health Science Center at Tyler. In today's episode, you'll hear and learn more about how data analytics is crucial for improving population health by tracking the spread of diseases and allocating resources effectively. Bridging information gaps between different data sets is essential for comprehensive data analysis. AI and machine learning analyze large data sets for better health insights. Why finding a mentor aligned with your goal is a key to success. Why skills in data analytics and management are vital for public health consultant. Why imposter syndrome can be overcome by taking a leap of faith and starting without overthinking, and much, much more. Be sure to hit that subscribe button and follow along for more.
Hi, this is Tarjani Vaidya. Also, you can call me TJ, and I am an independent public health consultant, and you're listening to Public Health Careers.
TJ, I'm excited to have you on the show and hear a little bit more about your journey. So welcome to this show before anything.
Thank you, Mari. So, I would love to share about my journey with you and your viewers. I think my journey started when I was pursuing my master's in public health from University of Texas Health Science Center at Tyler. And then I started working as an independent public health consultant with nonprofit organization and various academic institutions. So today I basically want to just talk to you about how I transitioned from being a microbiologist to be a public health professional and how my enthusiasm got me into infectious and chronic disease surveillance and what was actually the driving force behind my decision to become a public health entrepreneur. So a little bit something about my personal background I would like to share is I go by pronoun she, her, and I'm a first generation South Asian, a cisgender woman who is practicing independent public health professional and consulting in USA. So I currently live in Houston, Texas. I came to USA in let me say 2017, and I moved to USA for my husband as he already was settled here as he studied in Texas A&M, and he had a career here already, and he wanted to pursue his American dream over here. So I decided to follow him and see how it pans out for both of us.
Well,
Yeah.
I appreciate you giving that overview, and definitely very helpful as we jump into the journey and how you've gotten to where you are as a independent consultant, and like switching, as you said, from microbiology to then public health to infectious disease, chronic disease surveillance. Um, and I know a lot in your consulting work, you do a lot of work around data analytics. So I would love to hear, what is the importance of data analytics to improve population health?
Sure. I think the importance of data analytics is very crucial these days. As let's imagine a hierarchical framework, and we would say that population health is kind of at the apex, and then on which represents a very narrow, defined, and very precise health indicators with a specific amount of population. Primarily, this kind of data and this kind of research field is for uh, healthcare sectors and for healthcare practitioners. So when we pair up health data analytics with population health, we get a better understanding overall, um, and we of what are the trends in the population, and the healthcare professionals and the policymakers and the researchers um, get a better help and better help in making an informed decision, which is also evidence based. So, for instance, during COVID-19 pandemic, we all know the story. How COVID-19 unexpectedly bolted us and threw a curveball, as we say, um, to in front of us, and we had to like redo and discover a lot of new ways of research and incorporate technology. Everything went virtual. So data analytics came into extensive use to track the spread of virus, identify the hotspots, predict the future outbreaks, um, and this allowed the public health officials to allocate the resources more effectively and implement the targeted intervention to actually control the spread. Because the primary thing at that point of time was control the spread, because the variant itself was uh, crazy and it was changing every day, and we were still in the process of producing a vaccine, which was expedited as well, and a lot of red tapeism in clinical research was removed to expedite this vaccination launch and everything. So until then, we had to do what we had to do, and this insight was brought to the practitioners and the public health professionals as well, and it was kind of a tracker for community as well. That, oh wait, um, tomorrow I'm planning a trip to X destination, and what is the COVID-19 infection rate over there? What's going on over there? Are people getting vaccinated over there? What is the awareness of vaccination in that area? X amount and n number of possibilities, informations were available to community. So that's how data analytics played a very pivotal role, and it came up as a very critical tool to uh, have better outcomes in population health. Yeah.
And I like how you're breaking it down to like a tangible use case, because we think about like, okay, there's big data out there. There's all these different ways that we can use it. And specific to the pandemic, there were these maps that said, okay, there's a high transmissible disease, or like I know it was like red, orange, green. red is like there's the most amount of infections happening and things like that, and then that could really like help you decide what kind of behaviors you want to do if you want to go certain places. So really like saying how do we take this data that is out there and like use it to make tangible decisions in our lives. And that was a good example with the COVID-19 and how they categorize places.
Yeah, it's not just COVID-19, but we can also use it as a predictive analytics tool for preventing diseases. We can use it as using large data sets to understand how different population would respond to various treatments, leading to more personalized and more effective healthcare provided by the practitioner in that area. um, we can also understand that which population, or identify a particular population um, which is underserved, right? Because many a times the underserved communities at this in this kind of situation, fight or flight situation like COVID-19, um, is kind of you know, cornered or maybe forgotten or bypassed. But during this time, we actually saw that it was because of probably the neglected, or I would say, I don't know how would I put it, like mutually underserved communities, or who were not well aware of taking precautions, or um, being influenced politically, or various reasons, had barriers to understand and accept COVID-19, spread more COVID-19 infection. So absolutely allocating right awareness squads and access to the information, and how to manage the information, which is and to provide them information in such a way that it is under, understandable by a layman. um, yeah, that was very important and a key role, which actually health data practitioners, health data scientists were after. So yeah, that's the importance for me.
Yeah. And I'm thinking like once again, it's okay. We see these big data sets and we see how it relates to the disinvestment, marginalization of certain communities, as well as how we layer on top of that the health information or maybe lack of health information that goes to those communities. And this could probably provide a little more context for us to understand how can we work in these communities to better those kind of health outcomes. And could you just briefly talk more about like how can we work to bridge information gaps between like different data sets that are out there?
Oh, wow. So this is a great question. Okay, so I would like to build up a little bit on it. So I was fortunate working in a very dynamic settings with a research conducive environment, where I got to learn the craft from of data analytics and health data analysis from visionaries in the public health field. Um, and I'm basically also interested in combining the latest technology with public health methods, which helps us predict and forecast the potential public health impact. Okay, so and knowing I'm from a non-tech background, I had to put in hard yards to understand how the information comes in, how data collection is done, how manipulation is done, what are the sources, what are the right sources, what are the right formats which we can um, use or get the leverage to, actually give a constructive and constructive solution to public health. Okay, so I believe that uh, there is a vast sea of data which is available currently in the form of these data sets, enhanced data set, MCHS, HRSA. These kind of survey banks gives us a lot of data on various variables, demographics, um, etc., which is very important for a researcher to build a research question and lead on to their uh, eventual goal of proposing a better health policy. Okay, so often these uh, data sets, although being best sources of data, are generally found in its raw form and in unstructured format. And its volume is very high and it becomes a big data. Okay, so handling that is a skillful thing. For that, we have a lot of tools, technologies, and method in line which we can use to leverage this data and get into a better, insightful outcome. So, a lot of researchers face this struggle in managing the data first, integrate the data in order to establish the correlation between two or more variables, um, to produce a necessary insight for the research, okay, or derive a research question even. So from my personal observation and experience, I would say that to address this limitation, we need to be able to bridge the gap with most essential step is to constantly evaluate the collected data, uh, constantly update the methods of data collection, and identify the right tool with which data can be visualized or any kind of insights or analytical visualization can be gathered or performed. Okay, so for that, from available data, we need to know how to manipulate the data, that is, to how to clean, to format, and to transform the data into desirable format using various data analytical tools. These days, my favorite thing is just to unleash the power of AI. Okay, that AI has made, that is artificial intelligence and artificial intelligence tools have brought in a great ease in life of public health and health data researchers and scientists' lives. So my favorites are ChatGPT 4.0. I want to learn Julius, Gemini, Claude, and I can go on and on of for naming any generative AI tool. So that's that. And um, these AI tools can not just be used for statistical analysis. It can be used for your quantitative analysis and qualitative analysis as well, to get a better visualization of data, to compare and contrast, etc., etc. And there are standard tools which are SAS, SQL, Tableau, Tableau Public is amazing. You can do a GIS based uh, heat mapping and see actually where you can put a georeferencing, geotagging, everything. So you have to, for that, using that tools, you have to have a particular method to integrate the data, which is already manipulated now, okay? So, uh, what is data integrating or checking the interportability of data is the capability of combining, sorting, and grouping the available data with very ease. Okay. Using these kind of advanced analytical tools and machine learning methods, we can better understand the difficult aspects like how to create patterns in your data, how to create groups and compare and contrast, how to get the correlation right, how to get the association between two variables. Um, Next up, and the one which I have used as well is geographical systems. Like we can better visualize geographical disparities by using like tools like Tableau, and we can put all the data which is either available in either you have collected in CSVs or any Excel kind of a worksheet format, um, and you can get a better visualization of the geographical disparities and get a spatial view of health data. Okay, and the next method, which is kind of very important as well, we need a method which standardizes the data, which harmonizes the data to get better outcomes and see that there's no duplicacy, there's no um, missed entries, etc., etc. Um, Next up method would be health information exchange, which kind of facilitates the access of health records electronically with kind of a little bit better accuracy, and helps better response, uh, help responsive to the healthcare service. The last one, and a very favorite one, is public health surveillance. This system enables us to efficiently detect get early detection of the outbreaks. And the best example of this was a program by CDC. We all know this program as National Wastewater Surveillance Program. Uh, this was for COVID-19. Uh, this was a very path-breaking uh, public health surveillance program done by CDC in a very crucial time. So just if I have to provide some, like after this technical talk, if I just have to provide an easy iteration of that, we can combine the electronic health records with a predictive analytics software or a tool which can help us identify the patients at high risk for a re-emission of any diseases, or uh, knowing the targeted to better plan the targeted intervention to etc etc. uh, yeah, and the last one which I also worked on was combining the enhance with machine learning. So research, I'll probably further deep dive into this later on in our podcast, but just giving a brief about it would be researchers or my team use enhanced data, um, and paired it up with the machine learning algorithms by using statistical analysis as well, like doing linear regression, and then using a better statistical algorithm to identify the risk for a chronic disease and see getting a panning view of the current you know obesity or chronic disease, particularly depending with comparing it with how were the nutritional and dietary habits in the population or the community. Okay, yeah, so that's that's how I feel that bridging the gap and using the data sets and right tools, technology, and method would work. Yeah.
I appreciate that. That's a little bit of a masterclass there, going from looking at big data sets, knowing that they have this raw data, and how do you take that raw data and use it to for different reasons, whether that's for integrating it, whether that's for health information exchanges, combining it with other data sets to really see where things are standing out. But just knowing that, firstly, knowing that there are these big data sets out there, that there's raw data, and there's a long process that you can do with these data sets to extrapolate different sorts of information. And it's important that we are doing that as we're thinking about data analytics and data information. And once again, like the example of the wastewater, because I know that that was an important indicator and tracker of how COVID-19 was spreading among the populations. um, so shifting a little bit, and before we get into your journey, what does public health mean to you?
But this is an awesome question and a perfect timing when my emotions from remembering all the projects have come up. So, to me, public health is a non-negotiable right for citizens. Okay? By this, I mean that a country is only stronger if the citizens or the subject of the country are healthy. So it is a right of a citizen because public health is so far widespread. It brings out information from each and every field which a citizen or an individual encounters or uses in their day-to-day life. Okay, so being from mental health, uh, occupational health, environmental health, infectious diseases, epidemiology, etc. Everything. I mean, so public health blows my mind how intense and altruistic it is by nature. Yeah, so it's kind of a binocular which gives a comprehensive perspective to create an evidence based solution for the policymakers and healthcare professionals to take care of the citizens to lead a better life eventually.
Quick
Yeah.
break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at phmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show.
Yeah.
I love the non-negotiable right for citizens. I think that's an awesome framing, and we should all like start running with that.
Yeah. Okay. So
And
yeah. Um.
and
So
go
sorry
ahead.
to interrupt, but I actually have this intense kind of feeling. As I said, it's non-negotiable for me because I worked at the grassroots level back in India, and I realized what are the existing gaps of awareness, healthcare promotion, literacy, and how blurry lines public health and um, healthcare services have. Uh, it's amazing, yeah. So for me, it's important. It has personally impacted me because when I was working with Red Cross, I was obviously I got awareness about how much should be the blood hemoglobin level in women, because women are especially prone to anemia, be it an adult woman or a teenage woman. They do not know what their body is going through. So I personally became aware. I checked my blood hemoglobin level and became aware and started taking a nutrition rich diet since then. Yeah, so that's
And I think like going back to the perspective of like it's a binoculars, it's a lens in which we see the world and the systems that operate around us. Um, so I know you shared earlier about your path from like microbiology into public health into infectious chronic disease surveillance, as well as the transition from India coming to the US. So I would love to hear a little bit about that background, and I'll give the listeners a little bit of context on some of those trajectory journeys, and then you can go through it and highlight maybe some of the things that were important for you or like why you decided to pursue this. So you did schooling in India. You got your bachelor's of science in microbiology and a master of science in biotechnology at Gujarat University. And then you went on to get a postgrad diploma in intellectual property rights at Sir L. A. Shaw Law College, and then you went on to work as a senior lecturer and lab instructor and then an adjunct assistant professor. So and then after that you came to the US and got your masters of science in molecular medicine at the University of South Florida. So walk us through that process of getting your undergrad degree and then up until coming to the US for that masters of science.
wow. You took me through a whirlwind of my whole career journey. Yeah, it was awesome to hear that. And some people it might feel that, oh, what was she doing? She practically like going back and forth and changing her trajectory. But uh, this is the journey which kind of not just paved my uh, current career academically, it also made me into the person I am. So let's start with my schooling in India. Okay, so those were kind of a formative 5 years of my academic life, which also framed my character, my learning capabilities. I gathered the maximum skills um, in that period of time. So, um, like I mentioned previously, I was also introduced to organizations like Red Cross, and I got introduced to public health. But at that point of time, I did not know it was a public health uh, field that I was actually getting drawn to. Okay, at that point of time, I was just learning the courses like hematology, immunology, genetics, biotechnology, and I was happy using those skills and using that knowledge in my day-to-day life. Okay. Um, so when I was in my master's in Gujarat University, I actually got introduced with a few subjects which talked about intellectual property rights. And I was curious that, wow, it's not just enough to have an research IQ, produce a research work, it's also important to protect your rights. So that made me curious, and that led me to a postgraduate diploma in intellectual property, which was kind of a 1 year of a brief course with an internship, where I learned about trademarks, copyrights, but in detail, I specialized with patenting, and I learned during my internship how to draft a patent, what are the rules and regulations, what are the legalities which are involved in filing a patent, and understand what are the ongoing and very famous uh, lawsuits going on, patent lawsuits going on, and how are the what are the loopholes which those big um, giants are using against each other. And mm, yeah, it was amazing. It was a fresh breath of air for me, and I loved it. But along with that, um, it was a fact that I was not able to utilize this degree for getting a job. So I was not able to find a designated uh, job opportunity or a job title to use this thing, this particular skill. So I was drawn to um, education, academics side, academics, um, being an educator, and I started serving as a senior lecturer and a lab instructor. Initially, when I was working with my first university, like I have one tenure as a senior lecturer for 7 months with NIMS University and another with Gujarat University. So the first tenure was just all about the medical lab tech, educating medical lab technicians, people who were getting certified to perform uh, lab experiments, taking the biochemical tests, which like the blood test, phlebotomy, this, that, etc. Okay, so um, I used to plan lectures for especially the subjects like microbiology and hematology, and the syllabus was always given by the university, and I just had to curate the top which the references, books, and everything was like decided by the university. I just had to, plan out the lectures. Excuse me. Um, and I used to deliver the lectures in a very interactive manner, which the students were loving it at that point of time. I was kind of teaching a class of 30 students at a time, and it was a diploma course, so they had a course which was uh, they had some credits which were in class and some credits which were like they had to go for medical rounds in the labs, kind of an internship. So I was doing the tutoring part, okay? And the second role was more like a bigger responsibility because it was a bigger university and it was more inclined and aligning with my interests. Okay, it was an adjunct instructor, kind of a comparable position as US, but we used to call it assistant professor. Okay, back there as well. So um, this was particularly more of an instructor kind of a role, but only it was tenured track. Okay, so I was more of a um, permanent working lecturing professor over there, if it means something. So I used to plan and present the lectures for subjects like fundamental of genetics, introduction to biotechnology, teach the applications and methodologies of biotechnology. Yes, the role of intellectual property rights in applied sciences. So I thought I finally was able to give back that knowledge as well, and taking the exams, correcting the test papers, etc. The standard role for an educator. I performed the same duties. Yeah, so it was an amazing experience because I loved interacting with the youth. I got to know that what is the current mentality of the youth, how are the learning methods different from when I was in school. Yeah, so that was a great experience.
Yeah, well, thank you for walking us through that. And I could imagine from microbiology to patents and intellectual property rights, and then teaching it, and now shifting and transitioning to a Master's of Science in Molecular Medicine at the University of South Florida. Tell us about that transition and that thought process.
Okay, so yeah, this part of my life was absolutely a change in my personal life as well as I came here after my marriage. So it was a transition in my personal life and my academic life as well. So, but I just have to talk about if I have to talk about my Masters of Medicine, how did I get in? Was a simple process that I had to take a GRE because I was an international student and the score had to be greater than 300 or equal to 300. And I had to take a TOEFL, which had a score cutoff of greater than or equal to 100. And I got in, so I surely scored at least equal. So, and I got by that score I got into Morsani College of Medicine in University of South Florida. That made me move from uh, Texas to Tampa while my husband was still working in Texas, and he was so adorable. He supported my whole journey and my move and long distance relationship at that point of time. Yeah, so that was kind of led me to an unpaid directed research opportunity where I assisted in Department of Bioinformatics. There was this project of immunogenetics research study which was going on with the aim of quantitatively measuring the electrostatic complementarity of immunoreceptors with mutant peptides, which were specific to the lung carcinoma in a patient. Okay, so we were basically, in a simple way, if I have to put it, we were looking for biomarkers or immunomarkers, which showed us that why the lung cancer is worse or better, and is the chemotherapy or any immunotherapy working? Is any therapy working on the patient for the patient? And which is better, an immunotherapy or to identify or eventually put uh, the patient on immunotherapy by identifying that which immunoreceptor actually combines with the mutant peptide and decreases its effect of carcinogens. So basically, we had to investigate the survival rates based on that by using the current electronic health record. Okay, so my biggest thing I learned from this program was have to access the electronic health record. What is electronic health? How to manipulate it and how to analyze it, and um, what is the impact of health data analytics or bioinformatics on the public health. So that kind of, and then the situation was that when the pandemic started, I had to move to Texas because the USF requested to evacuate the campus because of the pandemic, and at least the people who can go back home should go back home. And I came back to Texas. I lost my internship at Moffitt Cancer Research, and things changed for me. And I have this realization for within me that public health is something I want to move forward with. So I transferred from molecular medicine program to public health. Yeah, and that's how I ended up into Master in Public Health in University of Texas Health Science Center at Dallas.
Yeah, and walk us through that thought process a little bit. What about public health really drew you to wanna get that master's of public health?
Sure. Yeah. So this program was, I would say, impeccably designed. It was a competitive program. It was a very hands-on and practically designed program for students, considering the current scenario which was going on in in the world. So we had to do a couple of few practicums and take particular courses, the core courses, and graduate by performing a capstone presentation for a year-long capstone project. So I moved to Tyler, and it was in the middle of pandemic. I was super duper happy doing that because I was getting to do all these things which I always wanted to. And I was getting a scholarship there with an on-campus job as a graduate research assistant and a coordinator. So that's how I got into the position of a community, being a project coordinator and a graduate research assistant for a community academic partnership for substance abuse. And I met my mentor, Dr. Yordi, over there, and she uh, and in this project, I had to kind of establish and nurture the collaborative environment within the diverse team of specialists from various walks of public health and community health and even the community stakeholders. So, and various partnerships, uh, and even the administrative department uh, within the Department of University of Texas. So I had to create monthly and quarterly summaries, reports, and create insights to update the steering committee to make better decisions and see how the funding, the research work is going on in the direction. I the main and a very interesting skill updating from this position was I knew how to use the virtual suits. By that I mean the Microsoft suite, the Teams, Zoom, WebEx, etc. Because I got to organize a pan USA virtual CAPSA conference, which was kind of uh, containing all the industry experts and community stakeholders and bringing 100 participants overall together. Uh, so basically, I eventually uh, created the content from that moderating and uh, facilitating the event and the conference. And I transformed and evaluated the research findings. I actually helped, assisted, and um, gave a compelling graphics to the advisory meeting after that. created a survey, a feedback survey, an evaluation survey, which actually helped us to see the final report for the grant. And yeah, so this gave me a skill of how to coordinate the project, how to liaise between the stakeholders and the partnerships. So that was also very pivotal. And then I did several internships slash practicum, which were kind of the first one was involved telephonic interviews and surveys, recruiting people using the health record, and conducting a qualitative analysis from the collected data and present a statistical analysis and visualization in front of the panel, uh, which was kind of uh, I previously talked about that using health records for the benefit of uh, observing and making better healthcare um, healthcare solutions and for the professionals as well.
Yeah.
Second internship was to study the relationship between the nutritional information, which I gathered from Enhance Survey Bank, and to seek the prevalence of diabetes, hypertension, high cholesterol, obesity, and other specific conditions, and how it relates to their nutritional habits. So I used statistical SAS. I learned SAS coding because it was part of my curriculum as well, and statistical analysis. I performed ANOVA and with SAS base, I was able to identify the risk population and present the results to the panel eventually uh, with the highlights, and was able to establish the importance of why we are seeking this to address these attributes. And yeah, so this whole UT experience was the maximum, is where I leveraged my skills to the maximum, where I learned and receive and gain most hands-on skills and experiences in public health field, one-on-one with people, one-on-one with stalwarts of the field, and it was an amazing experience. On a lighter note, I also survived an inclement of weather, so I also know now how to fetch a pail of water from a swimming pool and this and that, and it was amazing journey as well.
Well, yeah, thank you for sharing that. I think it really just highlights like the expertise that you were sharing earlier on health information and kind of like how that got started, starting off with the Masters of Science in Molecular Medicine, where you're able to learn about the electronic health records and start some data and analytics. And it seemed like you're really able to dive deeper and learn a lot more about that and apply a lot of that while you were in your Masters of Public Health program. And before we move on to your role after your MPH as a senior public health fellow at AI for Good Foundation, were there any takeaways about your MPH and I guess about your Masters of Science in Molecular Medicine that you wanted to share with us? Were there any takeaways from your Masters of Public Health and your Masters of Science in Molecular Medicine that you wanted to share?
Uh, the main takeaway was for me was how to you know keep on be in the process of keep on the learning mode on. you never know where your journey is taking. You just have to be open to learn, and learn, and be a be a person who can be molded and adjusted into any circumstances. So you don't know what kind of a curveball you're going to be thrown at, and just be resilient because at the end you come out as a stronger person. Yeah. So this was the most important takeaway because when I started my journey as a student in US, the worst, and when I compare my journey as a student in India, they are absolutely strikingly different because different education system, different education um, strategies, um, and and it was not that tough because I was closer to my family. It was not tough because I was in the country where I was born. I knew the rules of living there. So I was discovering the rules to live in US, being an immigrant, knowing the culture over here, and knowing how the education system works over here, how to go and talk to a bursar, how to get a scholarship, where to find a scholarship, how to maintain a scholarship in good standing, how to find an opportunity, and how to uh, how to make a direction through what you have a goal and a destination eventually. So yeah, that it has been a really great um, journey overall.
Seems like a great learning experience and great experiences that you've had over the time. And then you graduated from your Masters of Public Health and you became a senior public health fellow at AI for Good Foundation. Tell us about that role.
So um, my I thought that I had a great dynamic experience with public health during my program, and I would be killing the professional, like real time of action. But unfortunately, COVID-19 also changed a lot of things in the professional side, how to get a job, and everything. And especially being an immigrant, you are on a timeline, you are on a clock. So you have to get a job within your OPT time when and stop the clock and get sponsorship from your employer. So this panned out and increased a level of difficulty in getting job to me. So this opportunity at AI for Good was an opportunity which came in dire need for a job because I was being interviewed. It's not that I was not being interviewed. I was being I got an interview from CDC Foundation. I cracked small interviews with a lot of other organizations as well, but um, nothing was working out. So one of my friend told me that if while talking she saw that I'm on clock, my clock is going to end soon. So she helped me out and connected me with the CEO of AI for Good Foundation. We talked about, and he told me about his um, new innovative idea of combining um, AI with public health projects or community health projects to better the access of healthcare services in the community. And I think everything aligned over there, and it also opened up my world for knowing AI better and inquisitiveness of uh, incorporating AI and health data. So this So basically, I was initially doing just the research work, but unfortunately, during that time, I had to, my clock ended and I had to find another job. So could not produce, um, I could not produce the results with AI for Good of Foundation, and I had to move on. But I surely got a lot of skills by doing the research, the foundational work for the project, and working with the CEO. So that was a plus and a takeaway from that fellowship. This led me to an opportunity which was presented to me when I was just surfing LinkedIn, and I came across this announcement saying call for all the consultants. I was like, wow, what is this? Public health consultant. I read the job description that actually matched my profile, and it was actually uh, a very close inclination to my substance use experience. And I emailed and I was enthusiastic and I emailed my resume, and soon I received a discovery call invitation from Jacqueline and Dr. Amaka Anukaga, the founder and CEO of uh, Amaka Consulting and Services, Valuation Services. And since then, I was included in their pool of repository independent senior public health consultant. And yeah, I am constantly in that touch and presented with lots of opportunities of working with them. And that actually led me on to my career as a public health consultant. And while still I was searching, at that point of time, I was also searching. This was a part-time job, an independent contracting job with Amaka. So I was also searching for a full-time opportunity by then. And there was there was very difficult time finding, basically, let me say that I was stuck and confused in that part. There's when I decided, I came across Quisha Memba's profile and I connected with her. I also started following the journey of Quisha Memba, and then I came up with, I was recommended with a lot of women in the same public health entrepreneurship journey. That's how I came in contact with Dr. Desiree Strickland. And at that time, if I reckon, she did not have any programs for coaching, and so I went to Quisha. She took me under her wing, and she explained me, she mentored me, and introduced me to how public health entrepreneurship works, how to grow, scale, and eventually grow scale in this business. And um, now I have great coaches who are helping me throughout my journey of self-employment.
Well, that's awesome to hear that a little bit about that journey, as well as those three ladies that you mentioned. Dr. Ndidi Amaka has been on the podcast. Desiree has been on the podcast, and Kisha has been on the podcast. And I would be sure to link Kisha's book, Public Health Entrepreneurship, in the show notes for anyone that's interested in diving more into that. So maybe looking back on your journey as a consultant, what maybe what's some advice that you would give to someone that's thinking about going into public health consulting?
So, any public health consultant, then find a mentor that aligns with your favorite public health niche. First of all, identify the niche which you feel that's right and you have interest in and your experience aligns. And then find a mentor and just wait no longer. Just get into action. Step one step at a time, but keep on moving in silence, but keep on moving. You will find a sea of opportunities. That's what Keisha said. So you will find a sea of opportunities as you dive into this world of public health entrepreneurship. And as it's a very dynamic field, especially in the recent times, because there are lots of nuances and new avenues opening up uh, due to introduction of technology and amalgamation of technology and analytics and public health field. So yeah, and the second advice I would say that I'm from non-tech background, but it was not easy for me to equip myself with or learn the tools. But do it anyway. It is easier than it looks. Uh, keep upgrading your skills by learning tools. You don't have to be coding whiz, but become a subject matter expert right away. You can just start off with a steady knowledge of MS Excel, Microsoft Suite, Google Suite. Also, be this all these things all together will eventually help you to lay down the foundation of analyzing and collecting data, and you can move forward. from-
Well, thank you for that advice. And what are some of the main types of consulting services that you offer?
Yeah. So main type of services I offer is surely data analytics, data management, um, program evaluation and monitoring. So these are the niche right now. I am niche services, which I am kind of going with right now, and I will expand later.
Awesome. Well, look forward to seeing how all of that goes for you. And before I move you on to the Furious Five, the last section of the show, I'd like to ask where can people connect with you, and where would you like to see yourself in the future?
Sure. You can reach out to me on my LinkedIn profile, Tarjani Vaidya TJ MPH, and I'm very active and responsive there. You can reach out to me at my email, vaidyatarjani@gmail.com. I'm also very responsive over there. I'm currently working on my business structure and a website which will soon be launched. So just please keep an eye out for any updates.
Awesome, awesome. And when it's launched, feel free to share with me, and I'll share it in the show notes as well for people that check it out later on.
That's right.
But wish you much success in the near future.
Thank you.
You're most welcome. So moving you on to the Furious Five, the last five questions that I ask all guests.
Sure.
So number one, what advice would you give to a student trying to pursue a career in public health?
Oh, super. Please team up with your program coordinator to design your balanced degree plan, which steers in the direction of your goal. Also, don't discount your electives, which provides a graduation certification at the end of the course. That is going to be helpful. And lastly, take the electives, which strikes a balance, teaches you latest tools, data management skills, um, and where you can actually learn data analytics in public health.
Number two, if you are talking to someone wanting to get into your position, what advice would you give them?
Sure. As I mentioned before, we can always start with identifying the niche and dedication and finding a mentor. All these things would pair up well and will surely take you the position of being a successful uh, consultant.
Number three, what's something you're working on improving in your life right now?
Okay. Uh, so just if my somebody takes away my imposter syndrome, that'd be awesome. Then, because I'm working on this behavior of me or a feeling which kind of creeps in under the garb of being a perfectionist and wanting to achieve everything in a certain way and in a certain time. But sometimes you just have to start without overthinking it. Just go for it. Take a leap of faith. And that's what I'm trying to do.
And number four, professionally, do you recommend anything?
Yeah, sure. For a book, please read an intro to entrepreneurship for public health professionals by Krisha. And public health entrepreneurship, which helps navigating the intersection of purpose and profit by Krisha, Vanessa De Costa, Dr. Giovanni Spinner, Jometra Hawkins as co-authors. And the podcasts I would suggest would be PH Spotlight, the public health podcast by uh, Sujani Sivan, sorry, I messed it up. Sujani. Uh, and I also love Donuts and Data by Sitara. Um, Public Health Hard by Zoila Rena. Public Health Uncoded by Public Health Uncoded. And follow some LinkedIn gurus, which are like Anne Murray, Asad Naveed, Kushal Manba, Desiree Strickland, and some Insta pages which will provide you good information on data and healthcare informatics would be Citizen and Data Scientist by Preksha and Saurabh Modi. And I also follow Donuts and Data over there. So yeah, these are very motivational things which I also follow for my journey.
Awesome. Well, thank you for sharing that. I think I captured most of them here, and we get those into the show notes. If you want to share those after, that would be
Yeah,
great too.
yeah.
And then, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
So keep believing in yourself, keep exploring new avenues. You'll find your purpose, and at the end, mom is right.
Love it. Love it. Well, thank you so much, Tarjani, for coming on and sharing your journey, your expertise, the masterclass on like data informatics and analytics that you shared earlier. Was very very helpful. So thank you so much.
Thank you. Amazing talking to you and sharing my journey and my knowledge here at your podcast. Yeah, thank you.
It truly is my pleasure. Thank you all for watching or listening to this. Be sure to hit that subscribe button if you have not as yet. Leave a like, leave a review, and share it with a friend. Get someone who gets some value from it. But peace. See you all next week.